The conflict in Syria has had an incredibly damaging effect on the mental health of Syrian children and their parents, as they have witnessed the destruction of their families, their homes, and their communities. Thousands have first-hand experiences of bombings and shootings, whilst millions have had to relocate to new areas and experience different living conditions amongst strangers. In 2013, with help from Syria Relief, the National Centre for Mental Health was established to help children and their parents who are suffering from mental health problems due to the conflict. Shortly after its launch, the National Centre for Mental Health conducted an assessment of 1,500 Syrian schoolchildren and found that 96% of them needed treatment.
My name is Wael Al-Raas. I'm a psychiatrist from Syria. I'm the medical director of this center. We're doing rehab sessions for special needs children and also for people who've been suffering or injured during the war. I'm talking about ADHD, depression, PTSD, psychological issues. We start from taking mental state examination and doing therapy, like individual therapy or group therapy. Most of the children, if they came from Syria, let's say 2 months ago, you can see the PTSD symptoms clearly. A lot of them saw somebody of the family killed or arrested, or their places were destroyed, their schools were destroyed.
Successful rehabilitation of the patients is the ultimate goal for the doctors and the nurses who work tirelessly at the centre. Treatment can be a long-term process.
Now you can see another kind of symptoms for another kind of disorders. Now we're talking about depression, GAD, multiple phobias, the diagnosis of conduct disorder. We're talking about a kid who's not respecting any law, who's always violence in the school, the house, the street. He doesn't have a problem to commit a crime. And he is a big problem for the society, for the school, for his family in the refugee camp. The problem with conduct disorder is that those people, 75% of them, might go to another diagnosis when they became adults, something we call antisocial personality disorder or psychopath. And if you left them like that, you're being a big problem for the society. I'm talking about the Turkish society and the Syrian society. And any place those kids will be, they will be like bombs, so they can explode any hour now.
The task of the National Centre for Mental Health is enormous and is growing.
All of those cases came because of the large amount of seeing a lot of bombing, seeing their families killed, their neighbors. You're life-threatened every day, and you're hearing bad news every day, day by day. And you're short of money, short of work, like me. I lost my job, I lost my place, lost my clinic. So they are suffering. There's no one stable inside Syria. You're talking about 20 million people. Hardly you can see somebody stable, because it's not logic to be stable in such circumstances. That should ring a bell for everybody. We're talking about next generation here.
It is only through our continued support and your generous donations that the National Centre for Mental Health can carry on with their important task of rehabilitating family members into their families and their societies. Without such treatments, the future for thousands of people and their communities hangs in the balance.
To donate or to find out more about our work in Syria, please visit www.syriarelief.org.uk or call one of our friendly members of staff at our UK office on 0161 860 0163.